very warm welcome to you watching this later on, and to Karolina, who's joining me today to talk about secondary infertility. Karolina is an acupuncturist specialising in fertility issues, and she lives near me in Caversham in Berkshire. So we'll put the details below for how you can find her, and also anything that we mention in the recording, like podcast episodes and things like that. I'm interested in it because I teach pregnancy yoga, postnatal yoga. I'm very much in that world of meeting lots of women and couples that are thinking about conceiving, and I see them, sort of through that whole birth process. And I actually found out about Karolina through one of my clients, and she said that Karolina is amazing and you should meet her. So I, in my well-woman classes as well, sometimes somebody will share that they are struggling to conceive a second time. They already have a child, and perhaps it was really easy the first time, and they're wondering why it's not happening this time. And what often occurs to me is that with secondary infertility, it's more common than people think. So I checked the stats, and one place was saying that infertility affects 15% of the population in the UK. So that's 1 in 7 couples. And secondary infertility affects 5% of the population. So that's 1 in 20. So when you think about how many people you know, you're going to know somebody who is being affected by secondary infertility.
Yeah.
So Karolina, would you like to sort of dive in and kind of talk just a bit about how long have you been an acupuncturist? How did you come to specialise in this area?
Okay, so hello, thank you for introduction, that's very kind of you. I've been practicing now for 6 years, and pretty much from beginning I just start attracting fertility patients, and my first job was working with IVF clinic after I've graduated, so I kind of was thrown into that area of expertise straight away, while still studying, and I find it hugely satisfying to help people in that area, and I found that A, I'm enjoying it, and B, that I'm good at it. So I decided to specialize more, to study more. I've done diploma a few years ago in fertility, in terms of treating with acupuncture. I'm also doing more training in that area, because, like you said, there is more and more couples nowadays that are struggling with fertility, and very often people don't really talk about it. They don't talk to their neighbors or their friends. It's a very personal matter, and you don't realize how many people are actually going through it. You're only hearing the good stories, i.e. someone got pregnant, but you don't hear the journey following into that, to getting pregnant. And secondary infertility, it's just something that I see quite often actually in my clinic. And I think at the moment, potentially I've got maybe 10 to 15 patients actually coming with that. And don't know if you want me to straight away sort of get into the reasons why, but what I've been noticing is mainly people get pregnant with their first baby quite later on nowadays, potentially mid to late 30s, and they get pregnant really easily with the first baby. No problem at all. They haven't really thought about doing any tests. It just happens maybe on a first try or within 3 months of trying, and don't even think about potentially having issues with fertility. It happens. And they maybe leave 2-3 years after the first baby to try for a second, and then suddenly there is an issue. Maybe trying for 6 months, maybe longer, and nothing happens, potentially having a few miscarriages down the line, and then they start to do some more digging, some more research, what's going on. And I normally say to patients, if anyone who's listening to this maybe is on the same journey, you think, oh gosh, I had no problems I've never really done any tests, definitely test yourself, and not only yourself, but your partner. It takes two to tango. Things do change over the years. Sperm changes, quality of the eggs changes, we get older, we've got diminished egg reserve. And lately, I see more and more issues with thyroid as well. Obviously, women are more prone to thyroid issues, to Hashimoto's, so immune system, and you don't realize until you maybe potentially had few miscarriages or been struggling for a while, and you've done some tests. So definitely test yourself, and not necessarily with IVF clinic. I'm sorry to say this, but they're not necessarily going to check everything that you need to check. I'm sure you know this from your own experience. Sometimes it takes a village. So you takes your yoga instructor, a nutritionist, an acupuncturist, maybe a talking therapy practitioner. It takes a lot of people to actually give you that information, give you that knowledge, what you need. And that second time round, you will need to put a little bit more effort. So changing things.
So where, can I ask, so where would somebody go to get those tests if they don't go to the IVF clinic? Is it a private service that they can access?
Yes, they can access a private labs. First course of treatment, it will be IVF. It will be, NHS, and you can get some of the tests done under NHS. It all depends, obviously, with your practitioner. Not every single GP will be keen on sending you to do all this tests because, well, you have a baby already, so you don't have an issue, or there is an age, the postcode lottery in terms of the age, especially in our area. But definitely you can get some tests done through a nutritionist who's specializing in fertility. So they can do in vivo, they can do Dutch tests, but you can do private tests with places like Medicheck Lab. And then I think it's called Radox Health as well, if I'm not mistaken. But yes, Medicheck is the first one. So this one is quite nice because obviously it's private, you pay for it yourself, you have a few options. You either can order a kit that comes to your house. That one, not everyone is keen because you have to do it yourself. But with some of the fertility tests, obviously they need to be done at the specific time of the month. And with GPs, it can be difficult. Not getting the appointments in time, you need to be between day 3 to 5 of your cycle. So when you have a kid at home, that's more predictable. But with Medicheck, you also can pay a little bit extra, and you can have a nurse actually coming to your house and taking bloods for you. And you will receive result within 2 to 3 days, which is fantastic. And then you get sort of information written about your results as well. But definitely coming to someone who understands how to read the tests, because the spectrum of the lab results is quite wide. So under NHS, most of my patients receive the message, everything is fine, I think everything is within range. And then I look at the results and it's not within range. For example, if we say your thyroid within NHS or NICE guidelines is okay, is good or is healthy up to 4. But actually for you to ovulate, it needs to be between 1 and 2.25, for example. And if your thyroid isn't also within limits, they will not test free T3 or free T4 or thyroid antibodies, which are more precise what's happening with your thyroid, with your TSH in your cells than actually TSH itself, just for example. So definitely go to someone who's either going to be acupuncturists like myself that can read the results, and nutritionists that can read the results, and they can direct you to potentially then go maybe to see an endocrinologist, or if there's something wrong with a sperm, to see a urologist. Because IVF clinics, they provide you with IVF service, and that's absolutely fine, but they not necessarily will divulge to the issues, the underlying issues that you may have. So definitely, doing your research first, and potentially changing your lifestyle and having other things As you know, not everyone knows what we can do, what we can provide, or how we can help patients in that. It doesn't matter if it's secondary infertility or if it's pregnancy or postnatal. So each phase, women do need support. They need.
And I'm wondering whether, when you were saying that a lot of the couples are, older now, they're having children, maybe they've had a career already, and is it partly, do you think, once you've had that first child, life gets very busy and it might be more stressful, you're just generally fatigued, that there might have been that underlying condition, but it's been exacerbated by extra stress and tiredness?
Yes. So so that's definitely one reason. Well, first of all, when you're caring for a baby, when you're pregnant, you don't realize how much effort it takes from your body to grow that baby. So you're already kind of getting a little bit depleted. You potentially then have, maybe, I'm just giving examples, from what I've seen in my clinic, maybe you had really difficult labor, maybe you lost lots of blood during your labor, maybe you had a cesarean, and it's a surgery. So for example, you lose lots of blood, you become even more depleted, more deficient. If you've got cesarean, that's again the same thing, and potentially you get what we call cold uterus. So you might not have anything particularly going on wrong with your hormonal balance, but the trauma potentially of giving birth has caused some dysfunction in your body. There could be a mental blockage, but definitely I've seen a lot of, like you say, being deficient, being tired, exhausted. You're taking care of that newborn, stress. Life is very stressful. Your cortisol levels might be much higher than they were before when you were trying for a baby. Some women, and then it's completely understandable, you may be trying for 6 months and before you didn't try for that long, or even try longer, and they're getting really stressed about it all. Men have, potentially problems suddenly, maybe their lifestyle has changed, maybe their sperm is actually being affected, which we're not taking much into consideration, male factor. So definitely the whole process of pregnant, labor, postnatal, what's happening in those phases can affect your fertility, and then suddenly you're having issues falling pregnant the second time.
I've also known it as well that because you gave the scenario before of, perhaps the first time it just happened easily, and before you have children, there's more time available to be intimate with your partner, and you might not have actually thought of the best time to conceive in your whole cycle. It might have just been quite random when you were being intimate. And so sometimes, because I teach menstrual cycle awareness, sometimes it's quite helpful to really talk somebody through where where the fertile window is in their cycle. Because if they don't have many opportunities to actually get together, you might want to make the most of those situations.
You're completely right, and you will be the person to see about that, because the amount of patients that I see during the consultation, I ask them, when do you ovulate? They're like, no idea. So how are you supposed to know when you're supposed to actually try? When is your most fertile window? Some women don't know anything about the mucus. Or I've seen over the years patients, they just try potentially only once in a month. That's also not enough. Yes, potentially when they got pregnant the first time, they basically tried at the right time, but they don't know their bodies enough. They don't know what's happening with the ovulation. And definitely stress is another factor. Women could be more in their head in terms of worrying about maybe conceiving, a stress. Life can be stressful, like you say, not spending maybe enough time with your partner. So there is a lot of factors, and I'm sure you have seen it as well amongst your clients.
And if anybody's in that situation where they feel like, actually, I don't know when I ovulate, what's that mucus that Karolina just talked about? A really good starting point is to go to a website called Taking Control of Your Fertility with Tony Weschler, and there's information there, and she also has free charts, so you can begin to learn about what is your basal temperature, so then you'll know when you've ovulated, and you can predict when your period is due. If the temperature stays high, it means that you are pregnant.
Yes.
Lots of other factors that you can learn about, and that will increase your chances of
yeah, I've never heard of that website. There is a practitioner that is Hannah Pern. She is in London, and she on Instagram she posts her course as well about knowing your body, your fertile window, and learning about the mucus, what the mucus look like and what to look for. So yeah, there are a few people out there that you can do the course with, and just find out a little bit more about your body. But also definitely your clients can speak to you yourself, and you can advise them as well. And I do that a lot with my patients on what to do. And after consultation, I'll send them, for example, a letter after, what to do and how to find out about different aspects of the fertility, i.e. observing your body, maybe doing basal body temperature. That's very helpful, because not everyone ovulates day 14 of the cycle. It could be later, and it's completely normal for their body to ovulate later. But if they're trying on a day 14 and they ovulate on a day 20, that's just never going to happen.
Yeah, it's really important to have that knowledge about how your body works, and like you say, that everybody can be slightly different.
Definitely.
And then it changes over time. My cycle really changed before I had children compared to how it is now. It's sort of got a little bit shorter. So you might have really kind of known your cycle inside out before having the first child, but it would be worth spending some time charting or tracking your cycle to know how it is now, for sure.
Yes, I've seen that with patients as well. Either it suddenly becomes maybe longer or shorter, like you say, or heavier or lighter. Things do change after giving birth, not necessarily for a good or bad. It just changes, and you just need to learn your body again. So sometimes not necessarily there is something completely wrong with the hormonal balance or with the sperm itself. It's just small changes in your lifestyle, and you may not necessarily know until you start observing your body, or you speak to someone who specializes in that department. Like I said, it doesn't have to be an acupuncturist. It could be a nutritionist, could be a yoga instructor, could be someone that actually specializes in the fertility health, not necessarily a consultant or a GP. Nothing wrong with that, obviously, but I'm saying there could be someone else close by that you can do a course, you can take lessons, or you can do some treatment with, that can help you understand your body more. So that is definitely another reason. Definitely your cycle's changing after your first pregnancy.
Another area I wanted to ask you about was perimenopause, because I've had a couple of people in my classes recently who thought that they'd skipped a period because they were perimenopausal, and it actually turned out that they were pregnant. So the other, so I run sort of menopause workshops, and what a lot of people don't realize is that there can actually be a sort of surge of estrogen in the early stages of that journey that can take a good 10 years. And so for some women, there's actually an increase in fertility in that time before it starts to decline. But I guess for others, we're getting more and more women who are perimenopause and postnatal at the same time, which it causes, issues. So what have you noticed around that kind of time?
Normally that actually your body is basically protecting itself from, the last, is like a last call basically for your body, and that's why you become more fertile. Obviously we know through medicine, through science, that there is a surge of hormones in that time, but yes, women suddenly just get pregnant when they sort of also least expected in that perimenopausal stage, and that could be slightly later, and it's a huge surprise for some, because they suddenly get pregnant potentially at 40 plus. So I've seen a bit of that. I mainly see in my clinic sort of the either issues with labor or hormonal changes in terms of maybe a thyroid issue. But perimenopausal, I've seen this a little bit of that.
I wonder, the reason I'm asking is that I wonder if somebody is sort of in their 40s and they're thinking that perimenopause is kind of on the horizon, and they're struggling with secondary infertility, they hear, oh, well, you know, maybe it's too late and my egg reserves are running down, and actually something completely different is happening, like the thyroid. But it's like, because that's on the horizon, maybe they're not investigating other things that could be causing the infertility. So it's like a red herring, as we say in English, sort of misdirecting what the problem it actually is.
That's why you need, you need the test, you need the hormone test, so you can actually assess what's happening with your FSH, what's happening with your LH, what's happening with your thyroid, to know exactly what's happening to your body, because yes, it could start becoming perimenopausal, and we know now that it could take a long time. It could be 10 years plus, but you need to be able to understand your body. Not everyone's got the same symptoms of perimenopause. And for some people, obviously, it's starting earlier. So unfortunately, I've seen patients over the years at 35 becoming perimenopausal, so quite early on. And some, I've seen some consultants offering HRT at that stage to help them, because FSH is, really high, highlighting that the body is going through that sort of transition stage. So definitely investigating, testing all those hormones is very important, because you need to understand what's happening with your body. On occasion, there is something, what people don't realize is your prolactin being high as well. Prolactin, it should be only available in your body when you're breastfeeding or you're pregnant. So prolactin is stopping you from ovulation. And when you've got high prolactin levels, what's called as prolactilloma. So you have, basically, it's a benign tumor, and high prolactin will stop you from ovulating as well. It's easily treated, so that sounds scary when you're saying benign tumor, but you need to test that. You need to check what's happening with your hormones, and this can happen at any stage of your life. And then potentially going also to male, because we're not talking enough about males. Their sperm is diminishing over the years. It's more and more common that actually there is a male factor, and the amount of times I've heard, oh, my husband is fine, he had a children from a previous relationship, or there's never been an issue. And actually there is an issue, because the lifestyle, maybe there is some kind of blockage around testes, maybe there is too much heat around testicles, potentially maybe drinking too much beer that can cause estrogen levels being high, which one shouldn't really have, and or they're taking too many hot baths or saunas. Those things do influence sperm health. And going back again to IVF clinic, they only do a standard test on males, just the sperm test, but they're not checking their hormones. They also have hormones. I had a patient before that unfortunately had problems with erection, and they couldn't conceive naturally. They had to go for IVF, and no one has tested him. And I said, this isn't normal. He was 30 plus, really early 30s, and actually he had prolactilloma himself. But that was only discovered when I referred him to urologist, someone who's specializing in male fertility, in male hormones, someone who's going to do a scan on males, and something what we call DNA fragmentation that becomes more and more common in men as well. So they need to also take supplements. They also need to change their lifestyle. They might not necessarily listen to their other halves, but that's a topic for another time. but they also need to take responsibility for their health, because it could be nothing to do with the female. Like, it could be actually a male factor that needs to be also tested, but it needs to, the hormones needs to be checked as well, not just the sperm health. Because hormones could be stopping him from having a healthy sperm, or maybe a low testosterone level suddenly. So definitely investigating first, and having some kind of treatment, like your friend Becky, who does reflexology for fertility. She's fantastic. If they don't want to have needles, but something else, some other holistic treatment that can also help them to get the balance back in their life.
Yeah, let's talk about treatment with acupuncture. So if somebody's never come for acupuncture before, can you describe a little bit about how it works?
Sure. So maybe start from a first thing. So I do quite a thorough consultation. It probably, first appointment will be about 2 hours with the treatment. So you spend quite a long time with me, asking all sort of information to check your medical history, because everyone will have different reason why they have potentially secondary infertility. So they will need a different approach to treatment. And if they already had some tests, fantastic, I can look at them and potentially say, oh, there is a problem here. We need to go this route in terms of maybe referring somewhere else as well, because obviously I can only do so much. Sometimes you do need help from a Western medicine. And then you receive treatment. So treatment takes about half an hour. And for example, if I treat female, I'll make sure that I know where she is in her cycle, because she will need a different support in different stages. So definitely the first 2 weeks, she will need a support in nourishing her follicles and her lining, because that's the first 2 weeks that actually there is support of the follicle growth. And then in the further 2 weeks in her cycle will be the LH surge, so supporting the LH surge, the warmth of the uterus, the thickness of the lining, and potential implantation. I don't know if I'm giving enough information, then that's what you want.
I'm really intrigued about, because I've heard this before about sort of potentially getting cold uterus, post-birth, particularly if there's been hemorrhage or something like that. So can you say a little bit more about the sort of warming? And I've also got postnatal books that talk about the importance of keeping the mum warming after a birth, nourishing foods, physically kind of keeping warm, and snuggling in bed for, it might be up to 40 days, that in some cultures you kind of stay at home.
Yes.
Temperature turned up.
I know it's, for some people it sounds weird, what you mean, cold uterus or warm uterus, but it is important. And what I say to my patients, you are a walking incubator. Babies like to stay in warm environment. Your temperature goes up when your progesterone level goes up, say for example day 21 of your cycle, when you've got a progesterone surge, so your temperature goes up. So we know that the babies like to stay in warm environment, and cold uterus can happen through potential cesarean, if you had any other surgery, because obviously you exposed you in that cold surgery room, and that uterus can get cold. And in Western medicine, it's such a weird concept, saying, oh, that nothing to do with your infertility. And probably if you're speaking to your consultant about cold uterus, they will look at you like you're crazy. But actually it is important. So in Chinese medicine, there are obviously different meridians, and if you look at kidney meridian, that is responsible for anything happening in your in the lower jowl, so in your lower body, anything to potentially with your fertility, urination. Kidneys like to stay warm. I don't know if you ever heard, it's such a random thing to say, but you ever heard maybe from your grandma, keep your lower back covered when you were a teenager, keep your kidneys warm. At least that's what my grandma used to say. And obviously when you're young you think, insane, but it is important to keep that middle jowl warm, your kidneys warm, your feet warm, because that's where the meridian starts, to keep that uterus warm. And then we go into foods. So definitely dressing up warm, especially when it's cold outside. When it's summer, obviously I'm not going to ask you to wrap up like crazy. It's all within season. But in terms of food, you need nourishing food, so food that will nourish your blood. I'm not a nutritionist myself, but from Chinese perspective, I can offer some foods that will nourish blood. So for example, we say avocado, dried apricots, for example, and then, you know, beans. If someone eats meat, then definitely would recommend things like chicken livers or chicken broth. That's quite nourishing for the blood, and warming. And then it comes to warm food. So if someone will say to me, my diet is good, and they say to me, for breakfast I've cold a yogurt or cold smoothie, for lunch they have a salad or sandwich and crisps, and for dinner they maybe will have something warm, that's not a healthy fertility orientated diet. You need a balance, so you need to put a little bit more warm food, especially in colder months, into your body, to keep your body warm, and that's important. It's a small change, but honestly can make huge difference to your fertility.
I think that's so interesting, because it can be very, very confusing for people. There's so much information out there about what kind of diet to eat, keto or intermittent fasting, or kind of what exercise is good for you. Also things like cold water has become very, very popular, cold water swimming. And I have lots of friends who go swimming, Campsham,
Definitely
either, yeah, the rivers or the lakes. And as you're saying, you know, if you're actually trying to conceive and you're getting that regular, real chilling through of the body, that might be completely counterproductive to what you're trying to achieve.
Yes. And, you know, obviously, like I said, there's so much information out there, and you don't know what to go kind of with. Like, you can't do everything, because you're going to go absolutely crazy, and potentially very stressed about it all. Small changes, little by little. And also we have to say that everyone is different. So there will be people that will do the cold swimming or cold baths, and they will get pregnant, no problem at all, because after all, we are all different. But what I say, if you're already sort of maybe challenged in that area, you're already struggling, there's no harm in trying something new, something different, and maybe making few changes in your lifestyle, for sure. And that's where the consultation come into place. So I can understand what's happening in particular person's life, what their lifestyle looks like, and we'll ask the person to maybe make a few changes. I always recommend nutritionist that specialize in the area if they want to have a little bit more support, you know, from that side. But definitely small changes, sometimes honestly keeping warm and maybe not swimming, and some people will be upset with me when I say no running. So that's another thing. But yeah, you definitely need to just make a few small changes in your lifestyle when you're struggling, or when it's hard for you to conceive the second time. And another, you know, red flag, and I'm sure everyone knows about it, when you're trying for second time and you're having a few more miscarriages that you've never had before, you definitely want to make sure, check what's going on in your body, why suddenly you're having miscarriages. Obviously it does happen to us women, it's nothing uncommon, but there is more than one, then you need to, you know, question it, and research, potentially check something like your thyroid antibodies, maybe NK cells as well. I know you will hear from your clients, and I'll hear from my patients, but I've conceived first time, no problem, why suddenly I need all this? Things do change over the years.
Yeah, that's so helpful. I think you've given lots of really useful information for people to think again, maybe about the tests that they've had, and realize that they need some more tests done to really get to the underlying cause. So they've got that lovely platform then to take positive action and make those changes that you've talked about.
There is a really good book, I'm just looking, Is Your Body Baby Friendly?
Ah,
That's an interesting book to read for people, for sure. It's a one chunky piece of book. There's a lot of information, but if you want to learn more as well and understand different tests, that's a book to go. And then I'm just reading right now I'm not sure if I'm allowed to show a book or not really.
yeah, sure, yeah, sure.
I'm just reading this right now, Thyroid Debacle, and I followed him on Instagram. He does lots of videos about thyroid. Both doctors, they're American, they suffered for Hashimoto's themselves. So that's also a very interesting book about thyroid and how to test and what tests to have done, because unfortunately very often doctors are still following the old school way of testing for thyroid, and it's still not very regulated. So it's an interesting book to also learn if you've got maybe problems with your thyroid, to read as well.
It's a big topic, but you've mentioned thyroid a couple of times. So do you have a sense of why thyroid problems are increasing? Because I'm hearing more about it from people that come to classes. And
I think, well, first of all, like I said, there is more and more women nowadays that get pregnant later. So obviously, I don't want to, be horrible about the age, because, I had patients 45, 50 that get pregnant. And I'm always supportive. I never want to take away and put a downer on an age. That's not the point. The point is that obviously things do change with age in our body. And women are more prone to issues with thyroid. But reading this book, I'm still kind of halfway through, so there is a lot still for me to read and find out about thyroid.
it's a big book.
It is a big book. So interesting thing is, you might start having symptoms of thyroid issues, like gaining weight, memory problems, feeling cold, moodiness, potentially too angry, emotional, sometimes really irrational. You say how potentially feeling very tired as well, all those symptoms. But you testing for thyroid, or your doctor maybe send you for thyroid tests, and TSH comes back perfect, within norm, but actually very often really good. So they will not test anymore your free T3 or free T4, nor thyroid antibodies, because this is the rule. If your TSH is good, they won't test anymore. And doesn't mean your TSH is good enough, doesn't mean that your antibodies will be healthy. So that's the one thing. But you say, what's the reason? In this book, it says that, first of all, your thyroid needs to be like 90% of it destroyed almost, to show the levels really bad, really high. So that's kind of like almost too late to get some help. You want to prevent this. You don't want to go that far in terms of your health issue. But also says that you could have the right level of TSH being produced, but not the right level of TSH in your cells. And they mention here, obviously, one big factor of potential issue with thyroid is stress. Yeah. So we'll read this book, hopefully finish it next week, so I'll find out more. But this book says you need to potentially make some lifestyle changes.
And we know stress, also has such an impact on hormones, whether they're male hormones or female hormones. So that for me is a really big piece, is addressing stress, because I see people who are really struggling with, say, something like secondary infertility, but they're doing that stressful job still, and you understand why, because maybe there's a mortgage to pay, and it's a difficult situation. But if those stress levels stay high, it's very difficult for something to change. Yeah. And I just wanted to say, kind of, I think again, there's this, where this sort of perimenopause issue can come in, is that a lot of the symptoms that you were talking about with the thyroid can sometimes be attributed to perimenopause. So people are thinking again, oh gosh, maybe I've just left it too late because I'm heading into menopause, but actually it's a thyroid issue. So
yeah, it's difficult to check. It also very often, so for example, say you got pregnant first round, really easy, no problem at all. Obviously you didn't maybe do any tests at the time because you got pregnant without any issues. but the thyroid issue is already lingering, already happening, and you're not aware of it. And then suddenly 2-3 years later, you decide to try, and there is a problem, and you start testing, and you realize that you actually have thyroid issue and potentially antibodies, Hashimoto's, for example, because obviously over those years, you didn't realize that is already an issue. So that also takes time to show up in your lab results, for your GP to pick up as well, and not always necessarily taking levothyroxine is the best course of treatment. Sometimes actually speaking to nutritionists who specializes in that area will be good enough to help you with your thyroid. So sometimes actually changing, diet a little bit. So like I said before, it takes a village to.
But holistic approach, isn't it? Yeah.
I think we need to take the best of both worlds. There is no perfect approach. Western medicine has its sort of pros and cons, and I'm sure, and the same, holistic also have some limitations as well. So I always think combining the two as the perfect recipe, but definitely going more into, in olden days, how our grandmothers used to live, all the things that potentially we're forgetting now because we're all into research right now, taking medication, not necessarily eating well and living the right way. Life has changed immensely, and obviously we can't change the world, but we can make small changes in our lifestyle when you actually learn where there is a potential problem, what's causing it. And as you mentioned, the work and stress, very often my patient comes in and we talk during treatments, and they have this realization, I hate my job, I need to change it. And they do change it, but they kind of need that, maybe that push, that understanding, this is not the best place to be at. I'm better than that. I can do something better with less stress.